A patient doesn't necessarily do harm by waiting to have a total knee replacement. And in fact, our preference is to try to exhaust all of the conservative options before we even consider surgery. So usually that means attempting things like medical interventions, anti-inflammatory medications, cortisone injections, gel injections. There's a variety of non-surgical interventions that we can do prior to surgery, and in many ways can delay surgery until the patient absolutely needs it. By delaying surgery, the patient doesn't necessarily have a worse outcome, but it's just a question of how much pain and dysfunction does that patient want to take on. Now, one thing that can happen in certain scenarios is if the patient waits too long to have a knee replacement, they can have progressive bone loss. And so if you have a situation in which your arthritis is erosive and you're losing bone, that's something that your surgeon may want to intervene on early in order to prevent a more difficult reconstruction down the road. But obviously that comes on a patient-by-patient basis.